So hello everyone. Today we are going to discuss is about the oral habits. Right? So these habits, remember, they can be either thumb sucking, nail biting, that might be harmless at first, but if we continue them for long they can cause problem and cause problem with how child teeth grow. Now, can anyone think of any habit that involves the mouth, like the thumb sucking, nail biting? Oral habits are the things that we do with our mouth, uh, like like the thumb sucking on the thumb, biting nails. These are all example of the oral habits, or even pushing the tongue against the teeth. Some of these habits might start when we are very young, even as babies. So, why do these habits develop? Children can develop these habits for different reasons. Like babies, they naturally suck their thumbs because it makes them feel safe and comfortable. Over time, the child might learn to bite their nails when they are nervous or whenever there is an anxiety. So, that can turn into a habit. Now, children, what they see, they do. What they see another child sucking their thumb, they might start doing it. So if a child keep these habits for too long, they can start to change how their teeth that would grow. So can you think of what would happen if someone pushes their tongue against their teeth all the time? How to manage and stop these habits? And it is important to manage these habits early on before they can cause any damage. So dentists, especially who do not, the dentists who work with their children, they are known as pedodontists, can help you with these habits. Now these habits, they can be, remember, instinctive, like the thumb sucking, that start as a natural reflex, or it could be learned habits like the nail biting, which might cause due to stress. So they can be either learned habits. Example is the, remember, it's the nail biting. So imagine a baby sucking their thumb. At first they do it without thinking, but the more they do, the more it become a habit. Over time their brain and muscles, they work together, making it easier and more automatic. So that is how a habit it is formed. Now what are the some ways we can help someone stop a habit like the nail biting or thumb sucking? So let us classify the oral habits into two main parts. The classification is simple: obsessive and non-obsessive part. The obsessive part, they are the deep rooted, and non-obsessive are easily learned. The first is the obsessive part, that is the deep rooted part. So these habits, they are deeply ingrained in the person behavior and often have a psychological basis. So they are repetitive, intentional, or have a meaningful action. So these habits are hard to break and often require more focused intervention. Or these can be intentional, obsessive can be intentional or masochistic. So the intentional or meaningful habits, intentional is meaningful habits. They can be either these are the actions that person do intentionally even if they don't realize it. They often serve as a way to deal with stress, anxiety, or other emotions. Example is the nail biting. Example is the nail biting. Many people bite their nails when they are nervous or stressed. So this habit becomes a way to cope with those feelings. Other could be digit sucking, thumb sucking, lip biting. So these are digit sucking that is common in children. They do it for comfort. Lip biting, it is often done in moments of anxiety or concentrations. The second are the masochistic habits. So these are the harmful habits when the person might cause injury to themselves. So remember that the self-inflicting means they will cause injury to themselves. Example could be one may start gingival stripping that involves damaging the gums by using a sharp object or fingernails to strip away the gums tissue. So these so gingival stripping, remember, it's example of masochistic. So deep rooted, they are of two type: intentional, masochistic. The intentional, remember, nail biting, digit sucking, lip biting, and the masochistic are the self-inflicting that involves the gingival strip. The other could be non-obsessed oral habits. These are easily learned, means these habits are easily to acquire and easier to drop. They are unintentional and may not have the same psychological depth as obsessive. So they can be unintentional type or functional type. Remember that. The, the example of unintentional, these are usually not intentional and does not serve a meaningful purpose. Example that could be abnormal pillowing. It involves an unusual way of resting the head or face against a pillow that could lead to pressure or marks on to the minor issues. Chin propping means the learning the chin on the hand consistently that could lead to muscle strain or minor deformation over the time. Other habits could be functional habits. They may arise as a result of how the body functions or how a person uses their muscles. The example is the mouth breathing often occurs due to the nasal blockage. So remember, mouth breathing occurs mainly due to the nasal blockage. Or tongue thrusting that involves the tongue pushing against the teeth when swallowing, which can lead to malocclusion. Other could be tongue thrusting, bruxism. Bruxism is grinding or clenching the teeth during the sleep that can wear down the teeth and cause pain and jaw pain. So, non-obsessive habits are easier to start and stop, often unintentional or functional, like mouth breathing, chin propping. They may not have a deep psychological basis and can cause effect on the dental health. Now let us discuss the habits. The first come is the thumb sucking. So thumb sucking, you can see this picture. So thumb sucking is just one type of sucking habit, like sucking on the fingers or even sucking on objects like pacifiers or the hair. So why do children suck their thumbs? So we can classify the thumb sucking into main two types: normal thumb sucking, so that is normal in babies and very young children. uh, so there is a question in your entrance exam: up to what age do you see the thumb sucking as a normal? So remember that up to 3 to 4 years the thumb sucking is considered as normal. Remember that for your entrance exam point of view. Now remember, normal thumb sucking, it's completely normal in young children's. It happens during the first few years of life. At the young age, the thumb sucking does not usually causes any problem with the teeth. But if there is prolonged thumb sucking, if the child keeps sucking their thumb after a certain age, it can start problems with their teeth and shape of their mouth. So we can classify these prolonged habits into psychological thumb sucking. So some children suck their thumb because they feel lonely or insecure. The child might suck their thumb when they are scared or when they miss their parents. So they can be, thumb sucking can be either psychological or it can be habitual. Remember that habitual means there is no deep emotions. The child has developed the habit over time and it is hard for them to stop. So what are the different types of, there are other classification about the thumb sucking. It can be nutritive sucking. This is sucking for food when the baby is breastfeeding or drinking from bottle. That is normal and necessary for feeding. Other is the non-nutritive type. Non-nutritive type. So this is when the sucking is not for food but for comfort, like the thumb sucking. So this can become a problem if it goes on for a long time. Now let us discuss the different types of thumb sucking. The classification was given by Subtende. Remember that he divided it into 4 types: A, B, C and D. Type A is when the entire thumb it is in the mouth. So suppose this one is the thumb and it is in the entire thumb is it is in mouth and it touches the entire thumb is in mouth with the pad of thumb pressing against the roof of the, so entire thumb, so this one is the thumb that is in mouth, entire thumb is in mouth and it one is touching the roof of the palate. So it is seen in 50% of the individuals. Other is type B. The type B is the thumb, it is in mouth but it does not touches the roof of the mouth. The thumb it is in, so suppose this one is mouth and this one is the thumb it is in mouth but it does not touches the roof of the hard palate. The upper and lower teeth still touch each other. The option C, the type C, is only part of thumb just beyond the first joint is in the mouth. So the thumb touches the hard palate and upper front teeth, but it does not touches the lower front teeth. Remember that? And this is seen in 18% of the individuals. The last is the type D classification. Only a small part of thumb it is in the mouth. And it is seen in 6% of the individual. Other classification that is given by is the Johnson. Other classification is given by the Johnson classification. So Johnson classified the habits based upon the factors that influence the severity of the habit, like how often, how long the children engage in the habit, and how long and what is the intensity of the thumb sucking. So thumb sucking, it's a natural behavior that seen in the children even before they are born, and it is seen in 29 week of pregnancy. Remember that for your entrance exam it is first seen in before the birth as early as 29 weeks of pregnancy. That is important for, that is, this reflex is vital for feeding as it allows baby to suck and swallow milk. So remember, the thumb sucking is natural up to 1 to 3.5 years of life. for the young children. After that, non-nutritive sucking like thumb sucking should ideally decrease on its own. So it is a natural habit, especially for the young children. However, if it continues beyond the early age, it can affect the teeth and mouth. So have you noticed different ways that babies or young children suck their thumbs? How do you think these different styles might affect their teeth? Now, thumb sucking can be normal or prolonged. If the thumb sucking continues beyond 3 years, it can start to cause dental issues like malocclusion. So let us discuss the various theories which are related with the thumb sucking. The first is classical. The first is the classical Freudian theory. So according to the Freud, thumb sucking is linked with psychosexual desire. Psychosexual desire. So remember, the lips and the mouth, they are sensitive area that provide pleasure when stimulated. So this theory suggested that the natural urge to suck is connected to the deeper emotion. So remember that the Freudian theory, it was given by Freud. So the lips and mouth, they are sensitive area that provide pleasure when stimulated. So according to the Freud theory, there is a natural urge to suck. It is connected with the deeper emotions. So as the babies as the babies associate sucking with the feeling of comfort, warm and being held, they may continue sucking on their thumbs as way to feel good. The second theory was the learning theory. Remember, the learning theory is given by Davidson. So this theory suggests that the thumb sucking, it is learned. The they learn to babies learn to associate the babies learn to associate sucking with the positive feeling of being fed, comforted or satisfied. So when they want to feel these things, they suck on their thumb or the finger. Other theory is oral drive theory. Remember that the oral drive theory, it was given by Sears and Weiss. So you can get a question in your entrance exam, who gave the oral drive theory. It was given by Sears and Weiss. What does it says? This theory agrees with the Freud, but adds that the thumb sucking happen because of prolonged feeding. By sucking. So it is not about frustration from weaning, but rather the sucking action that has been extended beyond what's necessary. So that makes the child more likely to suck the thumb. So remember these three theories: Freudian theory, learning theory was given by Davidson, oral drive theory was given by Sears and Weiss. Now let us discuss thumb sucking. It is a habit many children develops at early age. So what are the causes of thumb sucking. The causes of thumb sucking could be parent occupation, socioeconomic status. A mother that is from higher socioeconomic status can provide more attention and nourishment to her baby. So that reduces the baby's need to suck for the comfort. While the lower socioeconomic status might not be able to do so. So how do you think a baby's need for comfort changes based on the mother availability? The more siblings a child has, less attention that might be given from their parents. Imagine you have three siblings, your parents are busy with them. You might left out and use thumb sucking and as a way to feel better. So the young siblings might initiate their older siblings to have habit of thumb sucking, leading to development of habit in them as well as. Another example is if baby is suddenly weaned off the breast or bottle, they may start sucking their thumb to satisfy their need or suck. Now, how can you diagnose? The important part is diagnosis. To diagnose thumb sucking, understand the psychological aspect, ask about the three things. One is the frequency, other is intensity, and third is the duration. So you might ask a parent, how often does your child suck their thumb? Does it happen more when they are upset? So remember the physical examination, you can physically check the digits. The finger involved in thumb sucking might appear reddened. The finger would be red, chapped with short nails. You may also see a callous part of that is the part of the that is a rough part on the thumb from frequent sucking. Other part that you can notice is the lips. A child who sucks their thumb often may have short lips. So remember for your entrance exam, the child who suck thumb would have a short lip. A weaker upper lip that does not close properly. A lower lip might be more active, pushing against the teeth. Apart from that, chronic thumb sucking can cause front teeth to push out that lead to open bite or misaligned teeth. Other thing that you can observe is the tongue. Now in the tongue, you can observe the tongue size, position. Children who suck their thumb might have a habit of pushing their tongue against the teeth when swallowing. That can worsen the dental problems. Apart from that, you can look for the other habits like mouth breathing, tongue thrusting that can accompany the thumb sucking. So these can also lead to the dental issues. Now let us discuss the effect of thumb sucking on the dental structures. Thumb sucking, especially if persists beyond early childhood, it can have significant effect on the dental and the facial structure. First are the dentofacial structure. So there would be proclined maxillary incisors. The upper front teeth may push forward, that is, the term we use is proclination. The mandibular anterior teeth tilt backward, the term we use is retroclined mandibular anteriors. And if you constantly push a door with a finger, over time the door would start tilting. Similarly, constant thumb sucking pressure on the teeth causes teeth to move. So apart from that, you can see diastema. There may be gap from the upper front teeth that can be formed due to the thumb pushing apart. Apart from that, you can see is important is high palate and narrow arch. Remember that for your entrance exam, that a high narrow palate may develop because of thumb preventing the tongue from properly pressing against the roof of mouth, causing upper jaw to become constricted. So upper jaw is may be constricted. Apart from that, you can see is anterior open bite. This is when the upper and lower teeth do not touch when the mouth is closed, often because the thumb in the way during thumb in the way during is in way during the crucial growth periods. Think of a garden where you place a rock on some of the plants. The plants under the rock won't grow tall, just like how teeth under thumb pressure does not align properly. Second, you would see is there would be pressure on teeth. The thumb usually the thumb it will apply pressure on the teeth lower incisors, pushing them inwards, and on the upper incisors, pushing them outwards. So these are the effect. Now what are the when person would constant suck his thumb, sometimes what happens is the child when sleeps with their thumb in their mouth all night, just like how wearing tight shoes for a few minutes is not harmful, but wearing them all day can hurt your feet. Constant thumb sucking can significantly impact the teeth alignment. Third is the finger changes. The, the finger may become red, chapped, that we have also discussed. The finger develop callus or the rough skin. The upper lips, the upper lips may be shortened, weak, while the lower lips may be more active. Apart from that, there is a V-shaped palate. The palate is V-shaped. Remember that for your entrance exam point of view, the palate is V-shaped and there will be misalignment of the jaw. The thumb sucking it can lead to gummed issues, decay, staining on the upper front teeth. There may be speech problems or there may be breathing problems. Thumb sucking may also cause mouth breathing. Remember that for your exam point of view, mouth breathing, thumb sucking can lead to mouth breathing. The thumb sucking may also cause mouth breathing, tongue thrusting, and speech problem due to changes in the mouth structure. Now let us discuss the effect on the maxilla. First of all, you would see the increased proclination of the maxillary incisors. Here you can see is the maxillary incisors, they are proclined. The upper front teeth, they tend to tilt more forward than the normal. So that you can imagine a book of rose on shelf leaning outward because something is constantly pushing them. Apart from that, you would see there is an increase in the maxillary arch length. So the distance, the arch length of the upper jaw may increase. There is increased anterior placement of the apical base of the maxilla. This angle, that is the SNA angle, you will see that the SNA angle, so this angle that would there would be increase in the SNA angle. So that is the angle between the and skull base and the maxilla. So there this angle would increase. The upper jaw is more prominent in the facial structure. Apart from that, you will see most of the upper front teeth may be exposed, making them appear, they may be appear longer. Apart from that, you would see increased counterclockwise rotation of the occlusal plane. Apart from this, there would be decrease in the palatal arch width. The roots, there can be increase in risk of trauma to these maxillary incisors due to the condition that they are more proclined. What would be the effect on the mandible? Let us discuss that. There would be increase in proclination of the mandibular teeth. The lower teeth may also tilt forward like the upper teeth. The lower teeth lean forward, making them less aligned. There would be increase in the mandibular intermolar distance. So molar to molar distance, intermolar distance, that would increase. There is a decrease in the maxillary and mandibular incisal angle. The angle between upper and lower front teeth, it becomes smaller. There is increase in the overjet. Overjet is the horizontal distance. The gap between the upper and lower front teeth when biting together increases. There is increase in overjet and a decrease in the overbite. That is so the vertical overlap between the front upper teeth over the lower teeth, it reduces. Apart from that, you will see increase in the posterior crossbite. The upper back teeth may bite inside the lower back on one or both sides. There is increase in the lower tongue position. The tongue may sit lower in the mouth, affecting swallowing and speech. Now, what are the other effects? Other effects like risk to the psychological health. Prolonged thumb sucking may be associated with anxiety or emotional issues. There is increase in the deformation of the digits. You will note that the fingers, thumbs, they may change shape or develop callus due to the repeated sucking. Apart from that, there is increased risk of speech defects, like you can see is lisping. So example, if a child consistently sucks their thumb, it can push the upper front teeth out, leading to gap, making certain sound like S, Z harder to pronounce correctly. Now let us discuss the management of the thumb sucking. The children, the first is the idle movement. Child often resort to thumb sucking when bored or about to sleep. To reduce this habit, you have to keep a child engaged in activities that interest him, such as painting, outdoor play, or the other hobbies. Second could be parental involvement to prevention. The parents should spend ample time with their child at home to alleviate any feeling of insecurity. The third, breastfeeding and bottle feeding practices. Ensure that the infant they are breastfeeded for adequate duration to satisfy their sucking urge fully. Mothers should hold their babies while bottle feeding. That creates an emotional bond similar to the breastfeeding. Apart from that, you can use is pacifier. A pacifier it can help us to prevent thumb sucking if the child has already started sucking their thumbs. Introducing a pacifier may be challenging. Treatment consideration that can be done is age factor under the 3 years. If the habit stops within the first 3 years, any dental damage like an open bite is usually temporary and requires no treatment. Between 4 to 5 years, we must stop the habit during this period as that can lead to malocclusion. After 6 years, if the thumb sucking continue beyond 6 years or into mixed dentition, the resultant malocclusion is unlikely to correct itself. So the child, you can motivate the child to stop the habit. Treatment is more effective when child is ready and willing to make any changes. The parental struggle to manage the habit positively. Both the parents and children should receive guidance during the treatment. Other factor severity of the malocclusion, self-correcting severity variation to in the oral tissue and presence of other habits like tongue thrusting or mouth breathing can be there. Now treatment approaches: if the psychological dependence on the thumb sucking is suspected, refer the child to the counselor. That can be done. Child for in up to age 4 to 8 years, they require reassurance, positive enforcement, habit awareness. We can raise using tools like mirrors. We can we can use study models to educate the child. Families, children should be understand the dental deformity and long-term risk of prolonged thumb sucking. Apart from that, you can do is the reminder therapy. Various techniques including use of reminder devices can help the child more aware of habit and encourage them to stop. Now what are the techniques that we can use is number one is the behavior. We can use is the behavior modification technique. So that is based on reinforcing the positive behavior and discouraging the habit. Positive reinforcement involves the rewarding the child for not sucking their thumb, such as favorite toy or special outing. Apart from that, we can use is hypnosis. In some cases, hypnosis has been effectively used to help the child overcome thumb sucking. So what role does positive reinforcement play in breaking the thumb sucking habit? So remember, the positive reinforcement strengthens the behavior of not sucking the thumb by providing a desirable reward and encouraging the child to continue avoiding the habit. Apart from that, the important part that you have to remember is Dunlop's hypothesis. So what's that? The Dunlop, he believed that forcing a child to focus on the act of thumb sucking while doing it would make the habit unpleasant, leading to cessation. So this method involves the mirror technique. So what is mirror technique? The child is asked to observe themselves in the mirror while sucking their thumb. That create a sense of self-awareness and discomfort. So that would lead to cessation of the habit. Apart from that, we can use of the physical deterrents. They are simple tool to prevent the habit by making it difficult for child to continue the thumb sucking. Apart from that, elastic bandages that may be used. The elastic bandage we wrapped around the elbow. The bandage prevent the thumb from reaching the mouth. So as the child fall asleep, so we can use is elastic bandages. That is a reminder. Apart from that, you can use is long sleeve nightgowns. So long sleeves interfere with thumb to mouth contact. That reminds the child not to suck their thumb during the night. So how does an elastic bandage help in preventing thumb sucking? The bandage, it restrict the movement of arm, making it difficult for child to bring their thumb to their mouth. Apart from that, we can use these various intraoral appliances. So various appliances we can use orthodontic appliances that can be used to prevent the thumb sucking. These can be either removable or fixed. Removable we can use is palatal cribs, rakes, or we can use is Hawley retainer. Fixed appliances can be used like the upper tongue screens, which are more effective. So what are advantages of using fixed appliance over the removable appliance? Fixed appliances are more effective as they stay in place, providing constant deterrence, while the removable appliances, they can be taken out by the child. Apart from that, we can use is mechanotherapy. In the mechanotherapy, fixed appliances specially designed mechanotherapy, we can use is fixed appliances that are used to prevent the thumb sucking. Apart from that, we can use is anti-thumb sucking appliances, like this one is the habit breaking appliance that can be used. So this device is attached to upper teeth and prevent the palmar surface of thumb from contacting the palate. Apart from that, we can use is the bluegrass appliance. So this one is the bluegrass appliance. So here what we do is we use a Teflon roller that is used to divert the child attention from thumb sucking to turning the roller with their tongue. So what is the primary function of bluegrass appliance in the thumb sucking? It redirects the child attention from thumb sucking to playing with the roller. That is why it helps you to break the habit. Apart from that, we can use this quad helix that can be used